Welcome back. Today we're going to be talking about anatomical position and some anatomical terms that we will be using during this school year. Anatomical position is fairly simple to understand, but you have to be in a certain position in order to know if you're talking about the front or the back of the body, etc. So in order to be in full anatomical position, the body needs to be erect. That means standing up. The feet need to be slightly apart and the palms facing forward. And I will get to the importance of that in class. In anatomy, we also use directional terms for different parts of the body. We're going to be using these in sentences. We're going to be using these in class. So it's going to make a little bit more sense when we're actually using the different terms and describing different parts of the body. But the directional terms are almost always opposites of one another. So superior and inferior are used as opposing terms. Superior means toward the head, and inferior is away from the head. Anterior and posterior are talking about the front and the back of the body. Anterior is towards the front, posterior is towards the back. Medial and lateral are also opposite terms. Medial means that it's closer to the midline of the body. So we have this imaginary midline that goes right from the top of your head through your nose, cuts your nose in two, and goes all the way down. And then lateral. Medial is closer to that midline. Lateral is further away from that midline. And then there is another term called intermediate, which is talking about a portion of the body that is right in between two other parts of the body. Proximal and distal are probably two of the harder terms for students to understand. Proximal and distal are used when we're talking about the arms or the legs. So we're talking about the point of attachment. Proximal means you're closer to that point of attachment. Distal means you're further away. So for instance, when you're talking about your arms are connected to your body at the shoulders. Your legs are connected at the hips. So when we're talking about point of attachment, we're talking about, is it closer to the shoulder, closer to the hip, or further away from both of those? And then superficial and deep. Superficial just means closer to the body surface, the skin, and deep means, further inside the body. In the book, it gives you some good examples of these terms and in two different charts. And you will be able to use the book when you are putting together your sentences. Also in the book, there are two charts. There's an anterior view and a posterior view of regional terms. When scientists or doctors are using regional terms, they're using the anatomical terms as opposed to the common terms for that portion of the body. So for instance, if you're looking at the line that is pointing to the mouth, that would be the oral or the oral cavity. The chin, they call that mental. Why? I'm not sure. The breastbone is called sternal, the chest area, thoracic, etc. And this is the same idea, but the posterior view of the body. The other thing that scientists do with the human body is they divide the human body with something called a body plane. And planes just divide the body into two parts. So, for instance, the sagittal plane divides the body into a right or a left part. A mid-sagittal plane is a plane that lies directly on the actual midline of that body that I was talking about when we were talking about medial and lateral. Frontal or coronal planes divide the body into front or anterior portions and posterior portions. Transverse or horizontal planes divide the body into superior and inferior parts. And then oblique section or plane cuts the body diagonally. And in the book, there is again another picture that shows you all of the different planes. The only one that is missing here is the oblique plane.